So let us begin with today's session on Allen's keynotes study streak. There are four remedies that we will be discussing. The first remedy will be Cactus grandiflorus. So when we open Allen's keynotes, the first line that is mentioned in Cactus is that it is suited to sanguineous congestions in persons of plethoric habit, like the remedy aconite, often resulting in hemorrhage or sanguineous apoplexy. So there are certain new terminologies which we have adopted, but the older textbooks are still in conformity with what they used to see long back, and apoplexy is one such term. In current age, it is layman's language. It is named as stroke, but in all our textbooks, all our books where the stalwarts have mentioned about conditions that have been affecting the blood vessels of the brain, they have mentioned apoplexy, especially if there is a lot of congestion and stroke related symptoms. So you will have to go and dissect all those books, all those terminologies, and find out what is it that is mentioned in the older books, what is mentioned in the newer books. Next we have is fear of death and believes that the disease is incurable. Now consider a case which is with cerebrovascular conditions, IHD, or lot of atherosclerosis, and he has a strong fear of death. Think of Cactus very strongly. We tend to give arsenic, but if we can go and just think of this remedy, we will probably be in a better position to help the patient. So next you have is hemorrhage from the nose, lungs, stomach, rectum, bladder. So the other remedies that we see are mentioned as Crotalus horridus, millefolium, and phosphorus. Next we have is headache, which is pressing like a heavy weight on the vertex, better by strong pressure, which is there in Menianthus, and if it is in climacteric, it is Glonoin and Lachesis. But before that, I think there was some physical generals which we need to also focus on, which is that there is hemorrhage from the nose, lungs, stomach, rectum, bladder, etc. etc. We saw the medicine's name mentioned was Crotalus horridus, millefolium, and phosphorus. Next we have is the symptom, which is whole body feels as if it is caged and each wire is being twisted tighter and tighter. So all those conditions where there is kind of a feeling that there are sensations which belong to the cardiovascular system or the arterial system or the venous system, and there is a kind of a vague pressure like feeling, twisting like pressure or feeling over there. Think of Cactus strongly. It will probably help you understand what is to be given. So yeah, all right. So next we have is constriction of the throat, chest, bladder, heart, rectum, uterus, vagina, often caused on by or aggravated by slightest contact. So we saw that slight contact aggravated many other remedies, like in arnica, least touch, least approach of any person used to cause a problem, or cause the feeling that the pains are aggravating. In Kalika we see that only the feet are sensitive. In some other remedy we see that certain other parts are sensitive. So in this way, for Cactus, it is everywhere the slightest touch aggravates, but even it goes further, and it not only gets affected by slightest touch, but it also causes constriction, which is very important. And then we have the head complaints, which I did read, and especially suited to women who have headache at the climacteric age, and the other remedies are Glonoin and Lachesis. So we have few people on the Instagram and YouTube. So yeah, so thank you, Dr. Sheetal, for your valuable comments. And it's just something that we are doing as a study streak from Allen's keynotes, reading all the similar remedies and some days it is 2 remedies, some days it is 4 or 5 remedies, and just trying to chip in my ideas and my comments about those remedies and how they have helped me, or maybe how you would see them clinically present in the patients. And that's how it's been going on. So thank you for joining, and we have many other viewers on YouTube as well. So next we have is headache, which is neuralgic and congestive and periodic and right sided, severe throbbing pulsating pain. There is, kind of a cerebrovascular headache, or you can say it is more of a neuralgic in origin, and most of the sensations of cactus would mostly relate or revolve around constriction and getting stuck up in that part. So next we have is oppression of the chest as of a great weight, as if iron band prevented normal motion. So something is obstructing to prevent to do a normal motion. That is what the patients will come up with, and we can try to find out if it is more of constricting like feeling and prescribe cactus on that basis. Right. So then we have sensation of cord tightly tied around the lower part of the chest, marking the attachment of diaphragm. Heart feels as if clasped and unclasped rapidly by an iron hand, and as if it is bound, darting and springing like chain lightning, and ending up with a sharp vice-like grip, only to be again renewed. So it's something like, some chain is put on your arms or legs. It goes and envelopes the part and kind of snaps again, removes it, and again goes back. So this keeps on happening. So maybe how we will see it clinically is that patients will tell you that the pains keep coming and going, and it is as if it is suddenly constricting that part and leaving in a snap. And that is what we also see in pulsatilla, we also see in sulfuric acid, where it is more of a gradual pain and sudden stoppage of pain or complaints with a snap. Here it is more of constricting pain and it is acute in nature, and it is, if it is mentioned it is darting and chain lightning, so it indicates that it is more of sudden pain that is happening. Next we have is palpitation day and night, worse when walking and lying on the left side. Also we see in the remedy cases. At the approach of menses is aggravation for cactus also. Next we have is menstrual complaints, where they feel that flow ceases when lying down. We saw this also in the remedy bovista, we will see, and also we saw this in causticum. Fever paroxysm returns at 11 am and 11 pm. This is a very strong modality for cactus. However, I have not cured any case based upon this modality. There are some other features and other parameters which I look for, and you will probably learn that in fever workshop if you wish to join it. You can compare cactus with Aconite digitalis, Gelsemium, Kalmia, lachesis and Tabacum, and that is why if it is related to digitalis and tabacum as well, I am taking up those remedies also in the next few minutes. So let us move to digitalis, which is very much a good remedy for heart, for liver and for many other complaints. For digitalis, the first line that we see mentioned is that there is a pale face which has a death-like appearance, and it is bluish red also. So if the condition of the face is mentioned, if it is your observation which has to decide, you know that the person has to be critical to reach that stage. There needs to be some toxicity or involvement of the improper circulation or breathing. So in this way you can try to find out whether it is pale face which looks like anemic, poor circulation, or it is more reddish, flushed face, which is more like a very strong circulatory remedy. And then you have the extreme opposite, which is the pale face and death like appearance. So it will mostly be an improper circulation, sluggishness of circulation, somewhere some part of the heart or liver or arteries have been affected. That is why this state will ensue. And if you try to just read this one line, you will get an insight into what the remedy will be doing on the human economy. And we'll read further. In cardiovascular system, we have, yes, we'll go to Digitalis in this app as well. So sudden flushes of heat followed by great nervous weakness and irregular intermittent pulse occurring at climacteric, aggravated by least motion. So there is a person who is having some cardiovascular disease who wants to just keep on sitting, not move. We think he is old, he may not move, but on questioning or asking, we will realize that maybe this person needs digitalis because he can't move, the pains aggravate, and the complaints also are in this age zone. Then you have someone who is affected with any of the valves. Most common valvular diseases that you will see is mitral or tricuspid regurgitation. If you have someone who is not breathing well, not circulating well, he has ejection fraction of around 50, 45, 50, digitalis will help him because it is a valvular insufficiency. That is what you will see in the 2D echo report also, and that is what the prescription should be about. There will be a face which is looking pale or bluish or dull like, death like, because there is improper respiration, improper circulation of blood, improper output from the heart, which is because of the improper valves and the heart action which is weakened. That's where you should think of digitalis. Sensation as if heart would stop beating if she moved. So everything in digitalis stems from this one sensation which goes around. In all my previous sessions, I have been telling that sensations may not be very well evident in many cases, and you will see mostly the modalities and not the sensations. There will be few remedies like digitalis, like cactus, because their heart action is on the heart, their action is on the venous circulation or the arterial circulation, and you will have someone who is complaining that I feel if I move I will probably skip a beat or it will not be noticed. So in such a case we can think of digitalis as very strong remedy for prescription. Cocaine is the another remedy mentioned. You will need to read it from different books. Maybe Boric is also giving very less about cocaine. Next you have is gelsemium, which is very similar to digitalis, but it needs to keep on moving. So someone who is weak but also keeps on moving just because he feels that the heart will stop beating if he doesn't move, that should require gelsemium. But if he is keeping on resting in one place, we should think of digitalis by corroborating the other physical journals and particulars which will be coming and reading further. So next we have is pulse, which is full, irregular, very slow and weak, intermitting every third, fifth or seventh beat. So many times in your clinic, especially in cases like geriatric cases, 50s, 60s, you will see that they are skipping a beat on and off. But if it is with these complaints that have been mentioned, we can think of digitalis. If it is not with these complaints but rheumatic complaints, think of other remedies by taking into consideration everything that is present, not just one thing, because sometimes one thing, if it is not very strong, may be missed. Patient should also have those complaints with the examination that you do, and otherwise it will probably be a one-off prescription which may work or may not work. Then you have blueness of the skin, eyelids, lips, tongue, and there is a pure cyanosis that we see. and there is distended veins on the lids, ears, lips and tongue. Fatal syncope may occur when raised to upright position. There is great weakness of the chest, cannot bear to talk, like the case of sternum metallicum. So all the metals I have kept for later study because they all have some common features, and maybe in very soon in a week or 15 days we will be covering all the metals as well. Great weakness of chest, cannot bear to be talked or spoken to, or he himself does not have the energy, that is why he will not talk himself. Respiration is irregular and difficult, and there is a deep sighing. So one of the top remedies apart from ignatia for sighing can be digitalis. You will have a patient who comes to you, may sit in the clinic and will probably not be able to share what is suffering from. The relatives will entail all the complaints and you will just observe the patient, but he is just there sitting and taking deep breaths. That is what digitalis would be indicated if the case is also having some cardiovascular distress, respiratory distress, or deathly nausea, which is what we are coming to next. So next we have is faintness or sinking at the stomach, and there is extreme exhaustion, extreme prostration, and he feels as if he is dying. Stools are very light and stools are very light, ash colored, delayed and chalky, almost white, and pipe stem stool, which is also involuntary. So you will see chalky stools, very similar presentation in Chelidonium and Podo. Both are liver remedies. Digitalis again is one of the top liver remedies. If you have some circulatory distress along with jaundice, think of digitalis as well. If the stools are whitish in nature, it means that a lot of disturbances have happened in the gastrointestinal tract. Think of calcarea, think of China, think of digitalis. And there is pipe stem stool, which is involuntary. Next you have is the urinary complaints, and there is a very strong indication for dropsy, post scarlatina dropsy in Bright's disease with suppression of urine. External and internal parts can be indicated wherever there is dropsy in internal or external parts, and there will be fainting in the people who are affected with such nature of diseases, but with organic affections of the heart. So there will be some case which has IHD or a problem that has developed over a period of long time, not due to external circumstances, but something that has disturbed internally. Think of digitalis in that case. If it goes with the soreness in the uterus region, the fainting spells and the dropsy, think of convallaria majus. Next you have is for male sexual system, there is mentioned that there is more or less nightly emissions with great weakness of the genitals after coitus. And then you have something in the extremities, which is that fingers go to sleep frequently and easily, and you have these scenarios in all the cases which affect the circulatory areas. Another remedy you can think of is Sickle core very strongly. Everything around the fingers and the dead end areas will be affected. Sickle core will be strongly to have been thought of. Next we come to his modalities, the last part, and you see that there is mentioned that it is aggravated by sitting, especially when sitting erect, and also aggravated by motion. China antidotes digitalis or its action, and it increases the anxiety. So next we come to is Lobelia inflata, which is a very nice remedy for again heart conditions and people who have rheumatism as well. So Lobelia, if we see, it is affected to, or it is suited to people who have best adapted to persons of light hair, blue eyes, fair complexion and inclined to be fleshy. So there will be one-off cases where you will think of Lobelia in cases where they are thin individuals. One case which I am treating is seemingly getting better with Lobelia because she has a history of getting exposed as a passive smoker and has developed heart disease without any known cause found in the entire history. So I've given her Lobelia inflata, and it is probably helping her because the episodes are less, she's taking less sorbitrate. So next we come to is headache, gastric and nausea, gastric headaches with nausea, vomiting. There is great prostration. So you saw digitalis, great prostration. You saw gelsemium, great prostration. Again in lobelia there is great prostration. And it is after an episode of intoxication from afternoon till midnight, and sudden pallor with profuse sweat is seen. Tabacum is one of the top remedies. In tabacum, the circulation is affected, but on the contrary, if you see, there is profuse perspiration which is also there. So that concomitant will guide you to the prescription of tabacum with the nausea, of course. And you can see in the head there is a very special mention for aggravated by tobacco or tobacco smoke. So this is what I saw in my case, and probably you can think of if you have cases of headache or cardiovascular distress having aggravation or ailments from tobacco or tobacco smoke. Then you have dyspnea, which is from constriction of the middle ear of the chest, dyspnea from constriction of middle of the chest, aggravated with every labor pain, and seems to neutralize the pains aggravated by exposure to cold or slightest exertion going up or down the stairs, and the other remedy mentioned is ipecac. So dyspnea and oppression of chest is a very common condition in all the respiratory distress, in all the conditions where there are cardiovascular distress. And if it is having some modalities which have been mentioned here, you can think of lobelia very strongly. Other remedy which you can think of is ipecac. Phosphorus and lyco are constitutionally very strong remedies. Think of those remedies only when you think that the entire constitution of the person belongs to these remedies. Giving deeper remedies in these deep-seated organic complaints is a good idea, but you should be sure about it. And how can you be sure? By looking into physical particulars, physical generals. If you find that the physical generals are matching a deeper remedy, go for a deeper remedy. If you find physical particulars are, there is one strong physical particular which you think is belonging to some small remedy. It can be a heart condition, there is a specific type of pain or dyspnea which belongs to cactus or lobelia or tabacum. Think of these smaller remedies, and with your chronic remedy prescription, give these smaller remedies in between, like 30 potency or 6 or 12 potency every 3 or 4 days. It is going to help your patient a lot, because the deeper remedies are doing their work in generally establishing their energies, the patient's vitality is being restored, but these smaller remedies will also push the patient in the positive direction from the organic areas. And this is how Burnett also worked. In fact, Burnett was more like draining the organs of the diseased materials. So there is a lot more to it, to Burnett and his methodology, but this is how I have adapted in my practice, where if there is chronic remedy coming, physical generals and most of the mental generals are covering, I would go for the constitutional remedy and give these smaller remedies in between every few days. That is going to push the local areas as well, and the bigger remedy does its work all the time. And that is how I've seen a lot of Calcutta homeopaths. We have arranged seminars of Dr. Sarkar, Sunil Sarkar from Kolkata, and he has taught it this way only. Some smaller remedy in between kind of pushes the patient in the positive direction locally as well. So that's what we come to this Lobelia inflata. And next we have is spasmodic pertussis, which is with dyspnea and threatening suffocation. Very less you will think of spasmodic pertussis for lobelia, but if you do think of it based upon the dyspnea, based upon the constriction of the middle of the chest, think of it based upon these things. Then you have gastric derangements. Yeah, extreme nausea and vomiting, morning sickness. Vomiting is there with where the face is bathed in, or face is covered with lot of cold sweat of pregnancy, and there is profuse salivation. So this is a very small thing, and but very valuable thing actually. And at times when we are taking the case, we often tend to overlook these symptoms. Lacrimation from the eyes, we saw that in chelidonium yesterday. Very strongly it is mentioned that there is fair gushing of tears from the eyes, and if it is a case of liver complaints, you can think of prescribing chelidonium. Similarly for lobelia, today we are seeing that there is profuse salivation. You can see there is lactic acid also mentioned. So in cases where there are heart complaints, you can just try to confirm from the patient whether you have excess of salivation, whether you have dryness of mouth, and you can categorize remedies and make your own chart and prescribe. That's how you should go forward. You can kind of take these things from different books, make your own chart, and make a totality of the patient when he comes. Next you have is if the profuse salivation is at night, we know the strong remedy is Merck Sol. So for Merck Sol, it is definitely indicative to prescribe it in cases where there is profuse salivation, but it also is a deeper acting remedy. Think of cases where there is syphilitic destruction. You'll have to study the pathology or physiology of the heart and the entire range of conditions, and then think of prescribing Merck Sol. There is chronic vomiting in Lobelia inflata with good appetite. Now this is a very interesting thing. Yesterday I had a case where the patient was telling me that there is bitter appetite, and then in another part of his case where I was taking his physical generals, he told me that I am having very poor appetite. I go to the repertory and I find something interesting. There is a rubric which says taste bitter with poor appetite. There are only two remedies, Carbo Animalis and Jaborandi. I saw his entire case, and Carbo Animalis fitted so perfectly well, and I have started with him. So this is how you pick up these things from different areas, bring together the components and prescribe. So that's what for lobelia it is, that there is chronic vomiting with good appetite. It is often overlooked. These small things are often overlooked, but if you try to bring the components, it will be very easy for you. With nausea, profuse sweat and marked prostration. So there is then faintness, weakness and an indescribable feeling at the epigastrium. There is something vague happening over here. If that something vague happening over here is before an event, or there is anxiety throughout the body, he does not feel anything except in the epigastric region, think of Kali Carb strongly, think of Mesothelium strongly. Go in the Kent repertory, apprehension rubric, there are 10-15 remedies, out of which Kali Carb and Mesothelium are very strongly present. But if it is with the vomiting, with the good appetite and marked prostration, marked profuse sweat, think of Lobelia inflata. And also this can be because of excessive use of tobacco. Tobacco eaters and tobacco chewers and tobacco smokers mostly have these symptoms. So you can find out it can be any of these remedies which have aggravation from tobacco or ailments from tobacco smoking. Next you have a sensation of congestion, pressure of weight in the chest, as if blood from the extremities is filling it, and he feels better by walking about. Sensation as if heart would stand still, deep-seated pain at the base of the heart. We saw some symptom very strongly present in syphilinum also, medorinum also, and if the same feeling is there in apex, then it is lilium tigrinum. So lilium tigrinum we covered, it was very interesting because it has two parts. One is the animal part and one is the plant part, and if you study it from the different sensations and different family point of view, you will see how the Liliflorae family, to where it belongs, the Lilium tigrinum, it is kind of thrown out from the family, or feels that he is excluded, and the patient will also develop some similar complaints. There will be prolapse, there will be some complaints which make her feel as an outcast, and it also has this vague sensation throughout its body where there is a conflict going on. In Lilium tigrinum there is a conflict at the level of mind, at the level of body also, and when you bring these components together you will be able to prescribe it at very easy way. So in Lobelia inflata we have this deeper sensation, especially at the base of the heart. If it is at the apex, we see that it is there in Lilium tigrinum. Urinary system, we see that urine is of a deep orange red color, copious red sediment, and this is there in many other remedies, but it has to come with the other complaints that have been mentioned. And then there is sacrum, which has extreme sensitiveness, cannot bear even the slightest touch, even of a soft pillow, sits leaning forward to avoid the contact of the chair with the clothes or contact of any object behind. So these symptoms that have been mentioned, they go along with the other symptoms that are mentioned in the other parts of the case. It can be heart complaint, it can be gastric complaints, it can be something related to head, and when we see these together, bring them together, we will be able to prescribe it better, these remedies which are small remedies, and we often don't get a chance because we tend to look at polycrests all the time, or tend to focus on the methods that we wish to always choose and lose out on the good prescriptions. Modalities, we have slightest motion, touch and cold aggravates, and amelioration from chest pain is amelioration by walking rapidly. And you see that Lobelia and Nux vomica are quite opposite in their action. You can find out what is best suited. For comparison, you can see Antimtart is very close, arsenic is very close, Ipecac, Tabacum and Veratrum are very close. So all these 4-5 remedies have a strong action on tobacco smokers, tobacco chewers. Find out the physical particulars from the patient, hold on to it and prescribe. So next we come to the last remedy which we wish to discuss today, which is almost similar and in fact a kind of a combination of all the remedies that we see. The remedy is Tabacum. So if you see, it has some elements of arsenic, it has some elements of Ipecac, it has some elements of Veratrum album, it has some elements of Lobelia digitalis and all the other remedies. If you wish to prescribe these remedies which you have never prescribed, you will have to get out of your comfort zone. And how is that possible? You will have to make your own rules of following certain pattern of case taking and come to these remedies. Otherwise it's never going to happen. There will be one remedy in your desk you will never touch, and for that not to happen you will need to study the source books, find out what is there in the cases and think of prescribing in afterwards based upon what you come up to from the case studies and from the books that you will touch. Diseases originating in the cerebral irritation followed by marked irritation of the functions of vagi or the vagus nerve. So I have always in all the past sessions tried to focus on telling you one thing, and that one thing is that if you read the first few sentences of the remedy, or that's in Allen's keynotes, or in Borik's Materia Medica, you will read the first general paragraph, generals which is mentioned. You will get an idea of how this remedy acts. Similarly, when you will opt to read Boger Synoptic, you will see that the first 4-5 words will give you a clue to the action of the remedy. For example, for antimproved it is lumpy effects. So everywhere, and there is stasis, mucus stasis. So in this way you will be able to understand how this remedy has a mucus stasis and goes and acts in other areas because there is mucus stasis. For Tabacum, number one thing is that it is a Solanaceae family remedy. So Solanaceae family remedies, all the remedies that we know of act mostly on the brain and the inner parts inside the skull, and this remedy specifically acts on vagus nerve. So if it acts on vagus nerve, you know that it will cause some gastric disturbances, and if your physiology is strong, if your pathology is strong, you will be able to prescribe these remedies where there is vertigo, there is nausea, there is gastric disturbance, and some sort of disturbance at the level of skin where there is lot of coldness. So going further, we have uh, feeling of excessive wretchedness and great despondency, emaciation of cheeks and back, icy coldness of the surface covered with cold sweat. Symptoms occur in paroxysms. You should understand this line: symptoms that occur in paroxysms. There will always be the presence of symptoms in groups. That is what it means. Asthma, sick headache, vertigo, sneezing. So there will be one system involved and then the other system involved. If you see this combination, and of course the vagus nerve should be the seat of action where all these complaints originate, think of prescribing Tabacum. Otherwise you are not going to touch this remedy forever. It will keep lying there in your desk, in your pharmacy, and you will probably get just 1 in 1,000 cases or 1 in million cases to prescribe. Get out of your comfort zone. Think of these prescriptions by connecting the different components of the case and get to this remedy. Next you have is hands which are icy cold and the body is warm, and complete prostration of the entire muscular system. So you have something which is belonging to digitalis, gelsemium, you have something that is belonging to lobelia inflata, you will have something belonging to veratrum and arsenic also down the line. And when all these remedies distillate one symptom from each remedy, you will think whether to give this, that, think of Tabacum. I covered very similarly a very beautiful session on Sanicula. If you are a new watcher on this particular Allen's keynote study streak, you have not attended the previous lecture on Sanicula, which was like almost a month ago, go back and see that session on Sanicula. It is going to enlighten you a lot because it helped me. This was 10 years ago, and still wherever in cases where I feel that there is a combination of 4-5 remedies coming, but I am not able to decide on one remedy, I think of Sanicula. What are those 4-5 remedies? Go back and watch that lecture on Sanicula. It's going to help you prescribe this out of the box remedy. It's not a routine remedy we will come across. These remedies will be understood when we go through a case where we find that there are 4-5 remedies coming, and then it's not there in the repertory sheet, it's not there in the materia medica in your view, but when you actually go and read it separately, you will find out that that is the remedy I should focus on, and it fits the bill totally. So that's what is for Tabacum also that we are reading right now. It has a combination of all these remedies, and you have vertigo, which is death-like pallor, okay, and increasing to loss of consciousness, relieved in open air and by vomiting. On rising or looking backwards or opening the eyes is aggravation. Sick headache which comes on every morning, intolerable at noon, and deathly nausea and vomiting, aggravated by noise, light, periodical, lasting 1 or 2 days. So there will be a headache or migraine situation which will last for a day or 2 or 3. Think of Tabacum in those cases. Sudden pain on the right side of the head as if struck by a hammer or a club. If it is pinpoint size, think of remedies like Ignatia, Calibicromicum. And if it is like a hammer struck, which probably very few cases will tell you, you can think of Tabacum. Okay, next we have is face which is pale, blue, pinched, sunken, collapsed, covered with cold sweat. If there is only cold sweat on the forehead, think of veratrum. If it is the entire face and the body as well, think of Tabacum. The eyes, there is a vision which is dim-sighted, and he feels as if he sees through a wheel, and there is strabismus or squint, which is actually current terminology, layman terminology, and which is dependent upon the brain troubles. So there is some block or some obstruction or some SOL in the brain which is causing these issues, then you should think of tobacco. Then there is loss of sight, which is amaurosis, which is the old terminology, from atrophy of retina or optic nerve. Then you have cardiovascular system, palpitation, violent when lying on the left side, goes off when turning to right side. Very interesting thing you will find in many cases. So as I have been telling in all the different sessions, modality should be your strongholds in all cases. Getting over to the patient and asking him whether you have this sensation is not going to help you. If you rely more on modalities, if you rely more on the particular symptom, it is going to be a very helpful guide rather than on sensations which may not be found and mental generals which are bound to be interpretation related, and you will get lost in that maze of interpreting symptoms here and there. Physical particulars, physical generals, no one can change. It is there as it is. Next you have is pulse, which is quick, large, small, intermittent, exceedingly slow, feeble, irregular, almost imperceptible. So you have a case of patient where there is coldness of the face, forehead, arms, legs, there is nausea, there is gastric disturbance, the body is cold, the circulation is entirely frozen up. Tabacum is the remedy if you also find pulse which is full, large. In fact, the different remedies have different pulses. For example, belladonna, the pulse is so active, it is vibrant, you can feel the buck shotting the finger. That is what Boric Materia Medica mentions. All these things are clinical observations and examinations which the patient should do to reach to a remedy, rather than going into the maze of finding that peculiar mental symptom which is not going to lead you anywhere. Something which is very much sure, like the pulse. One of the things is pulse. It's your understanding how many times you have checked pulses. If you have not checked too many, go on and start doing it right now. You will find out some very good insights into pulse. For tobacco, it is very much quick, full, large and small pulse. And in belladonna and bryonia, it will be very active, vibrant pulse which goes on like a horse which is racing forward. Then you have for gastrointestinal system in tobacco, nausea which is incessant, as if he is seasick. When you go to a sea and if you stay there for a few days, how will you feel? You need to experience that by going to the sea. That's what you will feel. And here the aggravation modality is from least motion and with faintness, better in the open air. So you see that in the first part of the tobacco in Allen's keynotes, there is a mention that symptoms occur in paroxysms. You need to understand this. When you will proceed in reading the remedy throughout the different areas, you will see that there is a combination of symptoms. There is vomiting with faintness, there is seasickness, there is desire for fresh air, there is terrible faint feeling at the stomach, and some vague nausea and some other symptom in another part of the body. So in this way you will be able to find out the remedy by connecting two systems and reaching to tobacco. For tobacco, further what we see in Allen's keynotes is vomiting which is violent with cold sweat soon as it begins to move during pregnancy. When lactic acid fails, another remedy mentioned in the brackets is Sorinum. There is seasickness, deathly nausea, pallor, coldness aggravated by least motion, and better by fresh open air. Terrible faint sinking feeling at the pit of stomach, sensation of relaxation of stomach with nausea. Other remedies are Ipecac and Staphysagria. Child wants abdomen to be uncovered. So there is lot of coldness. Any parent would want the child to take coverings, feel better. In such a case, if the child is throwing off covers, the adult is throwing out covers, think of tabacum as one of the strong remedies. It relieves the nausea and vomiting coldness in the abdomen, like the remedies colchicum, elapse and lachesis. Then you have constipation, inactive bowel or paralysis of rectum. Surprisingly, these symptoms were there in Sanicula, Syphilinum, you will see it in many other remedies. Tabacum will have its own characteristics with the other areas that are affected. There will be spasms of sphincter, there will be prolapsus ani of ear standing, and there will be herpes of the anal region. Mostly herpes occurs in the chest and the thighs. These are the broader areas where it will attack. Think of remedies ranunculus bulbosus, heparsulf and mesothelium as the first line of treatment. Tabacum as a remedy for herpes would probably be the second or the third level of remedies. So there is a video which I have put up many months ago when there was a cough epidemic going on, and how you need to segregate the cough into different areas. You can go and watch it on the timeline on Instagram or YouTube. So you will understand that coughs as a presentation in your clinic would probably require a categorization into different parts, and that is what the next workshop which I am planning to undertake, which is mastering coughs. So the first workshop which I am taking over in the month of August, which is just in next 20-25 days, 15th August it begins, is the fever workshop. Anyone who wishes to join can find out the details from the phone number mentioned and you can join. And next after this workshop, by September or ending or October, we'll start with coughs. How will you understand the different cough cases? There will be video cases before, after, what are the categories of cough, how will you rely on it, what you rely on it, everything about it. So that is the future plan, but you can stay connected for the other workshops and you'll find the details. Next you have is diarrhea. So there is constipation in Tabacum, there is diarrhea as well. Diarrhea which is sudden, yellowish, greenish, slimy, urgent, watery, with nausea, vomiting, prostration and cold sweat. So you see cold sweat accompanies the complaints wherever it goes. And the other remedy mentioned is Veratrum album. And then you have extreme faintness and excessive smoking, which also aggravates. In urinary system you have renal colic, there is violent spasmodic pains along the left side like the remedy berberis, deathly nausea and cold perspiration. This concomitant needs to be there for you to prescribe Tabacum. Otherwise you are going to just shoot the gun in the air without any aim. There was a very beautiful workshop which I undertook just a couple of months ago in the month of May, which was on renal calculi. Those who wish to avail the recordings can do contact, so we'll provide the recordings. And then you have the last symptom, which is icy coldness of the legs, especially from the knees to the bottom, and there will be trembling of the limbs. Next you have is amelioration, fresh open air and uncovering is very strong amelioration, better feeling for Tabacum. And now you see something that is mentioned in relations. So actually in the next few sessions maybe we can take up the relations first and then the remedy, because that is how you should come to understanding, by comparison and differentiating the remedies. Rather than reading one remedy from different books, you should compare the remedies from the same book, different remedies that are similar, you should compare it from the same book, which is what I have done in this entire Allen's keynotes. All the remedies that I have taken up, I am just going on marking all the related remedies where the sphere of action is same or they are related or there is some connection between those remedies. Sometimes I have given those remedies in my practice one after the other, established my own relationship of these remedies and came to an understanding that these remedies either follow well each other or need to be given one after the other, or they seem to be similar in practice and we need to understand by comparing and differentiating them. So for Tabacum, the last part which we also come to is that you can see it is very similar to Ipecac for nausea and vomiting, which is what I begin this today's session on Tabacum about, that it is like you are getting 4-5 remedies or 7 remedies in your vision, but Tabacum is nowhere there because the choice of your rubrics or choice of your components from the case for reading the Materia Medica is not matching Tabacum. But you think of Ipecac, arsenic, Nux vomica, phosphorus, veratrum, and there is tabacum lying on one side which matches all these remedies. So ipecac for excessive nausea and vomiting can be compared, arsenic for bad effects of tobacco, Nux vomica for gastric symptoms and aggravation on next morning after smoking, phosphorus for palpitation, tobacco heart, sexual weakness, and ignatia for annoying hiccup from tobacco chewing, and clematis and plantago for uh, tobacco toothache. Sepia for neuralgic affections of the right side of the face, dyspepsia, chronic nervousness, especially in sedentary occupations. And last but not the least, two remedies, lycopodium and gelsemium, which have their own sphere of actions and very similar to tobacco. So you have tobacco as a remedy which matches all these other remedies. If all these other remedies are coming in your repertory sheet, or you think of all these other remedies, or you are alternating all these other remedies, think of tabacum, that will probably help. In fact, let me take you to a beautiful part which right now I read, and that is about the sensation of tabacum. So if you read Dr. Sankaran's books, and you will come across that tabacum, of course we know it from our source books also that it belongs to Solanaceae. But what Dr. Sankaran did was that Solanaceae belongs to Cancer miasm. So there is a need to control about what he would be doing wrong or what is wrong happening to him, and that is why he has all these different vague delusions. So you go to the repertory and you will find some interesting delusions about the world, and the world must come to him, something like that. But the point is that it belongs to Cancer miasm. There is a need for control, and the control is one of the major things in tobacco which is missing, and that is why they get addicted to tobacco, and they can't leave this habit and they develop all these complaints. So it's kind of a analogy which you should adopt. There are different analogies that you should think of in homeopathy for these remedies, and you will be able to prescribe them in a fairly better way than thinking in a normal way, which is probably a really routine way of thinking. But for you to come to these remedies, it is a very different approach that you need to take. We had taken a workshop on the kingdom differentiation, me and my wife Dr. Anshu. She has studied under Dr. Shankaran, and we covered these remedies, different kingdoms, different cases that we took, and how they are improving, what kingdoms you will look into, how you will understand. So those recordings are available, those who wish to avail. And coming to an end, there is an upcoming workshop on the fevers. How will you treat such cases, different fevers? What will be the case taking pro forma? Everything will be provided, and you just need to join this workshop, and your cases which you have, some interesting cases that you wish to share about fevers in that period of time, we will help you to solve for that as well. So that's all for today's session on tabacum. In fact, we covered 4 remedies. One was Cactus, Digitalis, Lobelia, and tabacum. So you can contact for all the previous recordings of the workshops and the future workshops, and that's what I'm here to help everyone build a better sense of understanding of the source books and how clinically relevant you will find it in your clinics. So that's what calls for a day today, and let me see, there were a few questions in Instagram. Where do I practice? I practice in suburb of Mumbai. So if you wish to come to my clinic, you are welcome. You can drop a message, I'll send you the number. But if you wish to attend from your place my sessions online, you are free to contact. You will get all the details by contacting us. And I don't know in YouTube if I'm able to see the chat or no, but yes, let's make a move. So let's call it a day, and if you have any questions, please drop in the comments or send a message of the question. So I'll be happy to help.